First of all, welcome everyone. Thank you for joining us. Obviously, really important, timely call. Really appreciate Sandra, Jen, and Steve have taken the time to join us. For those who don't know, my name is Christopher Mark. I have a company called Vitality. We do soil stuff like EC surveying, bioavailability sampling. Anthony Rosado also helps out with this. He'll be joining a little late, but he is a financial planner working with small businesses, doing things like insurance, group benefits, etc. So obviously, very important topic. Before we dive in and I introduce and hand it off to Sandra, next week we have Dr. Julie Rosenberg joining us. We thought it'd be nice to take a little bit of a break from all the super specific stuff. She's got a couple best-selling books. She's kind of all over the internet, does lots, on CNN, stuff like that. And she's going to be talking kind of about leadership and obviously with a focus on crisis. And has some familiarity with the wine industry. So I think it'll be kind of really interesting and kind of really, really engaging content. So with that, obviously a lot of you know Sandra, but she's with Elysian Projects, which is a consulting company helping wineries and other artisanal beverage producers manage financial, operational, and human resource issues. Obviously, I'm sure a lot of you have been engaging with Sandra on that. She's been a tireless ambassador for the BC wine industry in her 25 years working in it. Steve Marino with WorkSafeBC. He's an occupational safety officer in prevention field services. He's 12 years with the WCB servicing the agriculture, horticulture sector, as well as beverage and food manufacturing and processing industries. And lastly, we have Jen Jacobsen joining us. She's with Interior Health as a team leader, and she's supervised the Penticton office as well as worked at the Vernon office, so has a lot of experience working with wineries. So before I hand it off, a quick note, what we're going to do today is we're going to keep everyone muted. We've got a lot to cover. So it'll be Sandra, Jen, and Steve kind of having a dialogue around health and safety. Sandra's brought a bunch of questions. If you have questions, we'll definitely have a lot of time for Q&A at the end. Message me with them or even just throw them into the general chat and I'll facilitate that and ask the question. So just for today, we're going to be doing questions purely by chat. So that's just, you want any question, just throw them in there and I'll be keeping an eye on that. So with that, let me turn it over to Sandra.
Thanks, Christopher. I'm glad to see people on today because it is timely. We had decided to do this, I think, at least 2 weeks ago before we really understood that tasting rooms were going to be allowed to be opened. In the past, we thought that was coming up around June 1st, so it happened a little bit faster than we were expecting. And that being said, I think the majority of wineries are still finding their way through opening protocols, and it's a good timing to have this. I've had a long relationship with Steve Marino, who's on the call, and I think I'm going to let Steve talk for a little bit about what he's seeing out there, and then Jen as well. And then I'll start asking some questions. But before I do, I just want to quick share something that I'm sure some of you know this already, but I just really wanted to be able to discuss it at the start to kind of set the tone. Certainly WorkSafe functions according to this. And I think if you haven't seen it before, it's really important to review it. Sometimes in the light of COVID, I think it's offering us a totally different look at hazards. And I think it's pretty effective. So the hierarchy of controls is really the very top one, elimination. That's what you want to be doing if you can. That you want to start at the top of that pyramid and work your way down. So, anything that you're seeing as a hazard in reopening, the best thing you could possibly do is eliminate it. And of course, that's what we've been doing for the last 2 months. We've been eliminating the hazard by asking everybody to remain at home. And as you can see, that's been wildly effective in British Columbia, and we have really flattened the curve. If we were to use that same mindset for everything we do, things would be great. But of course, as you know, in the real world, you can't always eliminate a hazard. Sometimes you have to learn how to work with it. So the next thing you should be thinking in your wineries is there a way that you can replace the hazard with something else? So for example, do you have to do tastings at all? That's a hazardous thing to be doing right now. Do you need to be doing them? You can either eliminate them, or I guess substitution-wise, you could move to something where you don't taste the wine. But again, little tricky. But definitely, that's the second level, is if you can substitute the hazard with something else. Engineering controls, this is one of the best things that you should be focusing on, especially for distancing. It's one thing to remember to stay within 6 feet of somebody, but it's another thing to put a physical barrier between you and the consumer that's 6 feet in depth. And again, engineering controls are, there's really no way around them for the hazard to come in contact with the employee or with the with the public. So certainly there have been some engineered controls like the Plexiglass, but again, be thinking all along of the 6 foot distancing and how you can engineer that to be more than just markings on the floor. The next one down is administrative controls. So that's kind of what a lot of you guys are working on right now, which are different policies and procedures that train your staff on how to handle situations and having certain protocols. And I think all of us are thinking about this one first and the one below it, PPE. That's kind of where our head is focused right now. But, really at the end of the day, when you're putting on gloves and all the rest, that's the very last thing in the line of defense you should be thinking of. The first thing you should be thinking of is elimination, substitution, and then engineering controls. So just wanted to kind of review that. If you guys haven't seen it before, it's all over the internet with hierarchy of controls, but it really does help drive some of your decisions. And if some of your employees, if you're suggesting an employee put on gloves and they're suggesting something that's higher up on this chain, like an engineered control or elimination, you need to really seriously listen to them and think about doing it that way instead. So I'm going to mute myself and let Steve Marino take over just for 5 or 10 minutes or whatever, just to discuss a little bit of WorkSafe's view on reopening and maybe some of what he's seeing out there.
Thanks, Sandra, and thanks for bringing up the hierarchy of controls. I'll get to that in a little bit. I just want to thank everybody for the opportunity to be able to participate in this. This is something that is, I find is important for me as an officer, and my employer, WorkSafeBC, feels this is critical for us to be able to do these types of activities to reach a broad number of people, especially considering what's been going on in the past few months. And what we're hoping to achieve is getting people back to work in a safe manner moving forward. So I hope everybody out there is well. I can't promise I'm going to have all the answers today. A lot of you folks may be more advanced on what's available than I. As things are changing, I'm being updated hourly. So my world is quite chaotic right now, as is Jen's, and all of yours as well. So I'll do my best to be able to answer questions or provide information. But what's happening right now with phase 2 is most of us have been pulled out of our general inspection activities, and we're tasked with reaching out to employers that are coming into phase 2, all of them. So not just wineries and that type of workplace, but I've got a list of 400 different workplaces that I need to try and connect with in the next 3 weeks, just to say, hey, do you have your things in place? So you may or may not see me coming through, but if anybody does need to reach out to me, I will respond. So as Sandra can send off my contact information. WorkSafeBC's got a lot of good information as well. But when Sandra was talking about the hierarchy of controls, I'm sure, or I'm hoping most of you have started or completed your COVID safety plan. It's not necessarily required by us, but it is required as a part of the provincial health officers' orders for restart. And we have the template for the plan on our website. This is it. Page 2 has the hierarchy of controls. Although, because of COVID, we have removed the substitution part of it, only because it tends to confuse folks as how can we substitute out some of our activities if we're trying to get back to work. So that part has been removed, but it's all based upon hazards and risk associated with those hazards. So as Sandra mentioned, the elimination part is the key thing to think about. When the personal protective equipment at the bottom of that inverted triangle is the lowest level of protection. So if you have to measure how we're protected, say from coronavirus, is a pair of gloves and a loosely fitting face mask, does that protect better than keeping somebody at 6 foot distance or possibly with a barrier where there is no exposure? So that's kind of that way to think about it, right? So Sandra did a great job of kind of running through that, but it is in the page 2 of the COVID safety plan that you'd be able to fill out and get it posted at your workplace and available to your workers. So what we've been doing for the past couple of months is actually inspecting workplaces that are active to see where they're at with respect to protecting the health and safety of their workers. We're not, we don't have jurisdiction and authority over protection of the general public per se, except for very few general duty responsibilities under the Workers' Compensation Act. So our focus is how are workers being protected? Interestingly, a lot of the provisions that have been put in place are protecting the general public as well that we're seeing. It's a sort of a two-way street where the workers are being protected and it's protecting the general public as well. So the main thing we're looking for is keeping people at that 2 meters, 6 foot distance, minimizing exposure, trying to empower workers to speak up and say, you know what, you're getting into my personal space. For both our protection, can we be separated? So we've got a lot of different things in place. I've created a bunch of documents here as we go through. Sandra's been nice enough to pre-presentation give us some questions that she's going to ask. And I've prepared some documents that I will show as we go through for some of the responses. So, Sandra, is there anything else you'd like me to cover? Or
people know that the safety plan, I posted a link to that on the chat area. So if you click on the bottom bar where it says chat, the links for that are on there, as well as the WorkSafe documents for preventing exposure, and then the 6 points of the overall plan. That link is up there as well right now. And that, again, hopefully Christopher can just make those links available after this as well.
I will do that, yeah.
So do we want Jen to talk a little bit now? Thanks.
Hi, everyone. So most of you will have met your environmental health officer. Most wineries that have, all wineries that have tasting rooms will have a food permit. So as mentioned earlier, I supervise the inspectors in Penticton and Kelowna right now. And then in the past, I've also covered Vernon as well as Salmon Arm. So really covered all the wineries up and down the valley. And so I think the thing that is the most interesting right now is trying to establish roles. So that's something that I know that WorkSafeBC and ourselves, essentially what we've done is increase the number of people in the team, right? So we've got more people now going out, inspecting, being into facilities that will hopefully help everybody make sure that they've got the right control measures in place to to reduce the risk, sorry, my phone's ringing, totally distracting, to reduce the risk of COVID being spread. We were presented with some questions, which I'm happy to go through. I think my big thing to all of you is, although COVID's important and we need to make sure that's in place, it's equally important that you remember your regular public health measures that are always there. So things like dishwasher temperatures, your cleaning procedures, your hand washing procedures, making sure your coolers are at the right temperature. So all your normal public health control measures that we talk to you about during our inspections, all of those are going to help. The reason those are in place is to prevent the spread of illness through the community, right? So normally we're talking about microbiological organisms, so bacteria, things like that. Right now we're talking about viruses, and many of the control measures are the same. So by putting those measures in place, as well as now your COVID measures on top of that, that's what's going to help to protect your guests and protect your employees. So I'll leave it at that. Sandra, I know you've got questions that you want us to go through, and I think that'll add some more content to it.
Okay, so I've been talking with obviously a lot of tasting rooms, not just wineries, but also cideries and distilleries as well. And it seems like the same questions keep coming up. So let's just start with the one that everybody seems to care about the most. And that is bathrooms. It's like, honestly, it seems to be the hot topic. So really the question is, I think that a few questions. One is, do wineries have to keep their restrooms open if they're open for business? Do tasting rooms, in other words? And also, if they do, how frequently is frequent cleanings of the bathroom? Is it after every single family type group goes in there, or is it every hour? So maybe, Jen, could you just kind of give us some guidance on that?
You want to keep your public bathrooms open. I think that's a lot of your local bylaws will require you to have a bathroom for the public, as well as for your employees. So I think closing the bathroom is not the right answer. Cleaning it frequently is, and frequently is a hard word, right? Because it's going to depend on how many people come into your winery, right? So if you get 5 guests in a day, you might clean your bathroom at the beginning of the day and halfway through the day at the end of the day, right? If you get 5,000 guests through your winery in a day, then you're going to be cleaning it a lot more often. So really what we're looking for is that you're cleaning frequently enough to kind of break that cycle. So I'm going to suggest that if you have a busy winery, you're going to clean maybe hourly. Right? If you have a less busy winery, try to aim for double what you did before, right? So if you used to clean it once a day, now do it twice, right? It's really going to be dependent on the number of people using it. I don't have a better answer than that. There's no magic number. It's really just making sure that, you're going in there occasionally and breaking that cycle. Having the least number of people exposed. If somebody went in there who had COVID and touched everything, what you want to do is kind of reduce the number of people who may have been in there in the meantime, right? Since you clean it, like between when that person was in there and when you clean it. So the more often you clean it, the better. But I understand that can be a task that's hard to get people to do, and it might not be something that you can do hourly. So you're going to have to, it's going to depend on how busy you are.
Okay. And is there anything other than normal PPE they should be wearing, other than masks or face shields and gloves? I mean, do they have to do anything in particular? Would you suggest that one employee is doing that throughout the day, or that be rotated? I had heard possibly maybe one employee should just be focusing on that, if that's a high use area.
Do you want to answer that one, Steve?
Sure. I totally understand the the stresses of the washroom thing, and it's human nature to be worried about, as we saw with the toilet paper fiascos of the past couple of months. The washroom itself, we don't see it as a additional hazard that is containing massive amounts of coronavirus. It's a place that people go to use. So when you're looking at cleaning, you'd look at your typical cleaning activities, using your typical cleaning materials and personal protective equipment to protect the worker from perhaps those touch points and from the materials or the chemicals that they're using to clean. So you're certainly not expected to be wearing a full Tyvek suit with a face shield and respirator. The expectation would be you'd have some sort of protection on the hands to protect them as if they're cleaning a toilet regularly, cleaning the touch points where people may touch. But you don't really need to look at any additional personal protective equipment unless we're looking at, as Jen said, extremely high use. If we've got lineups of people, maybe you want to look at change of clothes afterwards in case their clothing touched something or whatnot. But no, I wouldn't take it to the level that it's a toxic atmosphere that needs to have additional activities taken on it.
Okay, so a little bit about glassware. The most recent thing that I've been seeing that came out from the Wine Institute had something to do with the fact that if you can't, my assumption is, first of all, people all have commercial dishwashers as part of their license, and those all should be hitting the proper temperature, which, Jen, I'll have you speak to that a little bit. But is there any issue between when the glasses are loaded up into a rack? Let's say the customers do it themselves as they exit, and then the worker is putting on gloves, taking that rack to the dishwasher. Is there any issue with that process, taking it to the dishwasher, other than just wearing normal PPE?
So we're looking at handling glasses. It's considered what you would possibly look at as a touch point. So Jen and I discussed yesterday, and I kind of mulled it over a little bit, and it's just a matter of how you're managing the glasses after people are using them, or actually during the tastings. So the hope is that if you after you have a tasting, there's options that you can do as part of your procedures, is having the clients or your guests place the glasses in a designated area where they get put into racks into the dishwasher immediately, as opposed to leaving them hanging around. So there's options for, once they finish tasting, they put them back on the counter and step back, and somebody takes them and puts them into a rack or immediately into the dishwasher. You request the clients to place them at the end of the bar in a designated area where one person handles them. Every time somebody touches the glasses, they would wash their hands, right? So again, it's not a high risk thing, provided that you've got the procedures in place. So thinking about having a glass management system, right, and minimizing the handling, but also having the procedures and thinking about that 2 meter distance. So when a person finishes a tasting, you would expect them to place the glasses down and step back. So one suggestion I would make is, as part of your pre-tasting script, where you're talking about the varietals and the senses that you're going to experience when you're tasting, is part of that script would be, this is how the tasting is going to take place. Mm-hmm. I'm going to pour, I will step back, you will sample, and between tastings, you will step back, I will re-pour into the same glass without touching the top of the bottle to where the rim. And once we're finished, if you could kindly place the glasses to the end or leave them here, I will move them, wash my hands, sanitize my bar, wait for the next clients to come. So it's just a matter of getting your procedures in place. Thinking of just, that sanitation and keeping your hands clean after you handle them. And same with the designated person that will put them in the dishwasher. They don't have to wash every time they put a glass in the dishwasher. They can load once they're done, then they go wash their hands, right? So you have some reasonableness to it too. I don't know if Jen wants to add anything to that.
Not too much. I think one of the things Steve and I talked about yesterday was just making sure, like, for the people who are pouring, they're going to just need to be a little more aware that they're not like holding the stem while they're pouring, or that they're not, I mean, I know they normally wouldn't, but that they're not touching that wine bottle to the rim of the glass, right? And of course, encouraging only one glass to be used per tasting per client, right? So you're not switching it out when you go from white to red, because now you've got twice as many opportunities for that contamination to occur. So just really trying to limit the amount of touch on that. You can think of that wine glass as a shared surface, right? As a common touch surface between your taster and your client, right? So how do you control that? And really, when the pourer, the person providing the tasting, is giving out those wine glasses, before they do that, they should have clean hands. And, for optics, having gloves on may be appropriate, just because the public is going to question that otherwise. From phone calls, I can tell you they will. So, doing that in front of the client, putting on those gloves properly, washing your hands first, putting on the gloves, handing out the glasses, and then proceeding to do your tasting, leaving the gloves on or taking them off if you wish, and then washing your hands again. So just like Steve said, it's having a plan. I think that's the important part, is that you've walked through it in your own mind, and you've maybe role played it with, some of your employees, to ensure that there's not processes that you're missing, and telling them, like, watch for common touch. How far apart are we? What does this look like? Being aware, like, people touch that bar a lot, right? Mm-hmm. So how are you going to clean that? Where are you going to work that into your process?
And easier yet, I've heard that many wineries will be pre-pouring glasses before the customers come in, and setting them out for the customers to take as they stand back. So there won't even be that worry of touching the bottle to the top of the glass if you do it that way, right? Great. And just one more thing, just to refresh people's memories, what temperature does the dishwasher have to get to?
So it's 70. Okay, hold on. I'm checking, because I don't do a lot of field work. So it's 82 degrees at the manifold. So if you have a dial, usually you're looking for that to read 82. If you are using a thermometer or test strips in the actual dishwasher, you're looking for 72. And that's kind of at the dishes. Now, I don't know if anyone has chemical dishwashers, but you also want to make sure that those are working properly. So if you are using chlorine in your dishwasher, it needs to be at 50 parts per million. If you're using iodine, that needs to be at 12.5 parts per million. So those are, I think the big message is that what I said at the beginning, making sure that those procedures that you should be following every day are still being followed, and that you're more aware of them. So if you have had your dishwasher off for 2 or 3 months, it might be worth getting your maintenance guy, your dishwasher maintenance person, to come in, run it through, make sure it's working properly prior to opening. That's
a great idea. Can you also just, I'm just trying to think, because so many wineries have restaurants, what's the easiest way for a server to serve a plate to a table of people without coming within 6 feet of them? There's been a lot of memes out there on that, and some great videos, but I think in general, we're definitely looking for, yes, we're definitely, I think the wineries with the glasses putting out it seems to be a little bit more logical, but when it comes to serving plates, that's the people are already sitting, and it's a little bit more confusing.
So we've actually put some information on our website under industry-specific procedures to help, say, the restaurants, pubs, and the food service in the wineries would fall under that. There's a whole host of general considerations with table service. I've got, these are several pages of things. And there's some procedures in there for servers. And they're good starting points. Things to think about, like having an open end to a table, or removing a chair and making that the drop point for the food, right? And then having your guests that are sitting at the table pass their own plates around. Thinking about that is some higher end restaurants like to preheat their plates. So you may want to consider dropping the temperature of your preheated plates so your guests aren't burning their fingers as they're passing their neighbor's food around. So thinking of that, it's that booth type of setup where you have an open end as the server would drop the plates and walk away. Sometimes it's not always practicable. You may have to ask the guests to stand and step back and serve, right? So it's just taking the reasonable precautions. One thing that I always like to think about pre-planning. So you may have guests that have special needs that may be in wheelchair or have mobility issues that in advance of the serving coming out, you might want to give them notification that say, you know what, the food's coming out in about a minute. Maybe somebody in your party can help you move so I can drop the plate so that we protect both of ourselves. So it's thinking about all of those things. So if you go onto our website and go into the phase 2 opening and look at the procedures for restaurants, cafes, and pubs, you'll find a lot of that information in there. It's already laid out for you. And then you just have to make it specific to your workplace.
Okay.
It's about minimizing exposure, but planning it as well.
All right. Do you guys want to talk a little bit about the face shields versus masks versus wearing both of them? I know that most people on this call should know that the face masks are really only effective when both the server and the person they're serving are wearing them. And hopefully they're also 6 feet apart, and hopefully one of those people doesn't have COVID. So, but what would you suggest with respect to one versus the other, neither or both?
I can start off. We talked about this yesterday and thought maybe because we have some publications on this as well, but we've been maintaining from the beginning that WorkSafeBC is not mandating the use of any kind of mask or respirator at this present time. Now that comes through, that's changing. And it's changing not that we're requiring it, it's changing as if it has to be maybe perhaps a consideration if your ability to maintain that 2 meter distancing can't be achieved, and your exposure is high, which means it's a repeat exposure within that 2 meters. There may be a consideration for use of a type of mask. The face shields generally I'm seeing more in food production, poultry processing facilities where people are basically working almost cheek to cheek. And that's a protection for splashing and whatnot. So when we're looking at a face covering, there are 3 general styles that you will see. You will see the cloth style mask, the surgical style mask, and then the respirator, this N95 or P100 type of respirator that you'll see in healthcare and in other industries. So if you look at the mask is to generally, unless you are fit tested properly, is only going to prevent exposure to from a person wearing it to somebody else. So you're not necessarily wearing the mask to protect you. So things to think about we're looking at the cloth masks, if that's an option, which are those reusable ones. They're being manufactured with lots of cool little designs on them and whatnot. Taking care of those is critical. So you have to look at cleaning them. If they get soiled, you have to change them out. How do you wash them properly? I've got a lot of fruit packing places now that are going to a different color mask every day. So they know they're not using the Monday mask on Tuesday. They're not using the Tuesday mask on Wednesday. So they're color coded. Again, they're working close in proximity to each other, so they are using it. The surgical masks are single use only. The N95s or P100s that you're seeing out there, we're recommending those only be used in healthcare. Primarily because of the short supply, and the cost is more. And unless you've been fit tested and understand how to use it properly, it's no more effective than the cloth mask or the surgical mask. Now, that being said, we have some things on our website. We have the selection and using of masks, which is a 2-pager, and it gives some really good information. And we also have a how to use a mask to prevent the spread of COVID in multiple languages. So those of you that have the vineyard side of things with SOP workers, or you may have English as a second language staff, you can print it off in multiple languages, and it just shows how to use it. The critical thing with masks is you're depending upon them too much to protect yourself, and you're not thinking about how you're wearing them and how you're handling them. So if the outside is soiled, are you touching them with your bare hands, and are you transferring material? So it's just like gloves. Just because you have them on doesn't mean you're protected. It's just a barrier. So again, we're not requiring them, but you have to look at what point are you so close to your coworkers or your clients that you may need to implement something like that. If you're close to your clients, you may be requiring your clients to be wearing them to protect the workers. Mm-hmm. So I don't know if Jen's got any additional information.
The one thing I did want to say is that one of the things with masks that you need to be very aware of is that for somebody who's not used to wearing a mask, the tendency is to adjust the nose and adjust the ears and play with it, and oh, it's bugging me, it's itchy, right? So what am I doing? I'm touching my face, right? And we all know that if you're touching your face, there's a potential to get that contaminated surface into your mucous membranes, into your eyes, your nose, your mouth. And those are points of infection, right? So you're now potentially taking a contaminated surface, whether it be the bar, whether it be your hair, whether it be whatever, and maybe you've touched that and now you're touching your face because you're adjusting your mask. It just, I guess what I'm saying is that masks can actually lead to more risk of infection in some cases if they're not used properly, if people aren't hyper aware of what they're doing when they have them on. And like Steve said, we rely on them too much, right? We need to remember that upside down triangle and rely on the top, which is the social distancing, right? So if you're a fan of Bonnie Henry, like I am, the social distancing and the hand washing are the keys. The masks are
way down.
I'm gonna say they're there to make us feel a little better, but I don't know that they're actually doing a lot.
Mm-hmm. Fair enough. They are way down.
Sandra, just one quick reminder too, that when if you're expecting a worker to cover their face with something, if they're suffering from a medical condition such as asthma or COPD, that restriction of the breathing can put them at risk of serious complications. So that's something we need to be aware of as well.
Right. I'm kind of wondering about the need to take temperature checks for your employees. There's definitely a lot of confusion over, obviously the intent is that a sick employee stays home. And I know with WorkSafe that sick employees are being asked to stay home 10 days. So I need a little expansion on that. Like, if they're better in 2 days, can they come in? Those kinds of questions. But also, how do we deal with temperature checks? Are they worth it? And who's doing them and where and when, and privacy issues?
So temperature checks aren't worth doing, I guess. There are places that are doing them. In my opinion, and kind of the stance that we've had at the health authority, is that they're not a good indicator. If you check somebody and they don't have a temperature, all it tells you is they don't have a temperature. It doesn't tell you that they don't have COVID. It doesn't tell you that they're not sick with something else, right? We do know that the symptoms of COVID can vary quite drastically between individuals. So some people will present with really drastic symptoms, including fever. Other people might present with only a mild cough or sneeze. Other people won't present at all. We know children often can carry it and spread it around without having any symptoms. So it really, really varies. We also know that by the time you start showing any symptoms, you've been contagious for a couple of days already. So if you're taking the temperature of somebody and they have a high temperature, it'll tell you to exclude them. But what about everybody else? So the bigger question is, it's more around just saying, are you healthy? And creating the culture. I think this is something Steve and I talked about yesterday, that really the thing around sick employees at work is, as a society, and especially, I hate to say, but especially in the retail and the service industry, it's really changing that culture, that idea that, oh, we're short-staffed, I really need you to work, to, okay, you're sick, please stay away. And so it's building that relationship with your staff so that they feel comfortable coming to you when they're sick, that they're not going to be in trouble, that they're not going to be chastised, and you supporting that, right? So it's changing the culture so that is something that they are comfortable doing, and that they know that they need to be off work.
Okay, so just a couple, not role playing per se, but a couple situational things. One, I've had a question about what happens if you've lowered your occupancy of your tasting room. You're doing, let's say, 2 groups, one at one end and one at the other. They're staying the proper distance away from each other. And one of the patrons lets out a huge sneeze without covering their mouth and nose. How do you deal with that? I mean, really, it is a concern, because honestly, if that person really does have a virus, I mean, other than normal sanitizing after that happens, what else can you do in the moment when something like that happens?
Say bless you.
Yeah, we got
sorry,
that.
I'm being cheeky. No, there's not. I think the message is that people sneeze for a lot of reasons. Yeah. People cough for a lot of reasons. We don't need to panic. I think my reaction, if I was standing there and somebody did that, would be to hand them a tissue and hand them some sanitizer, right? Maybe wipe the counter down if you're concerned, but it doesn't need to be taken further. Like it's right. Not, you don't need to worry about your HVAC system. You don't need to worry about closing your tasting room and doing like all points cleaning or anything. Just common sense. People sneeze. Like right now, my face is all puffy. My eyes are black. I've got like the worst allergies this year, and I walk around all day sniffling all day and like coughing because I'm just a hay fevery mess. And it a lot of people are suffering from that right now, right? So I think it's one of those things where we need to understand that there's other things out there. We need to trust that our patrons are aware of the risks, and that there's signage out there: cover your cough, wash your hands, have tissue available, have sanitizer available for them. put some signs on the door saying, if you're sick, don't enter. There's lots of proactive things you can do, but if somebody sneezes, there's no need to overreact. I don't know if Steve wants to add anything to that.
I agree. Only that we have a poster to prevent COVID from covering, so you can actually post this. Not everybody will cover up, but actually it's something you can put in the workplace. And basically it just drops down to washing hands and sanitizing afterwards. Yeah. There's not much you can do about people sneezing.
Okay, I wanted to have some time for Christopher to feed us some questions. And I also wanted at the end to make sure that, just so you guys know, we have been putting some links up there, especially a new one for the BC Food and Beverage Company or organization, which has gotten government funding from BC to accumulate. Some people would call it stockpile. I would call it accumulate. Both gloves in larger quantities and face masks. And you're eligible to purchase from that if you're in the agricultural sector, which all you guys are. So that just came out this afternoon, and that was put up on the chat. So Christopher, why don't you ask some questions and we'll field them.
So one of them, what about spittoons?
Well, I will take that real quick because we'll also be posting the new guidelines, I guess, from the Wine Institute. And the way they've handled spittoons is that you should still make them available, but in disposable cups. It's not really appropriate not to have spittoons for lots of reasons, as you guys know. But if somebody is the designated driver or not, and somebody just wants a spittoon, you should have disposable cups there available, and then you dispose of them properly at the end, washing your hands. Same thing as cleaning off the glasses. So I don't know if you guys have any additional to that on that one.
Jen just mentioned yesterday we were talking about this topic, and either disposable cups or having a second glass that can be removed and poured out and put into the dishwasher.
Right. So. Yeah.
Yeah, and so just had a follow-up. What about individual spittoons that are dishwasher washable?
Yes. If you can treat them like glassware.
I think the key is that you're not sharing them between customers, right? So as long as whatever you're providing is provided for that customer and then removed and cleaned or discarded, then it's meeting that purpose, right?
May I ask a question about spittoons? It's just Jonathan here.
Sure.
Just in regards to the spittoons and what Christopher asked, what if you're containing visitors to single households or bubbles to one table? Can you put a dishwashable spittoon or two or three down on the table for just that one group to use, and then they get cleaned and sanitized? You're not giving them to other groups.
That's a good question.
I think the risk is low if it's a family group. I guess my caution around that is that although people may come to a wine tasting together, when you're spitting in something, the risk is increased, right? We know that this virus is in your mouth, it's in your lungs. So if somebody has it and they're spitting into something and you're sharing that, I think the risk is higher. So I think my gut reaction, I don't have a definite answer, and Steve disagree with me, but my gut reaction on that is no, I'd still like to see individual ones.
I don't know a lot of wineries that are going to be able to get a straight answer sometimes from people, whether or not they truly are in the same household or not, if they want to get into your winery. I mean, the Stagettes are pretty obvious. They don't live in the same household, but others not so easy to ask that question.
From a worker health and safety perspective, it does increase the potential for exposure, right? So you'd have to have additional precautions in place on how you're going to handle that shared glass afterwards, right? So we're not looking at through the general public or the clients, but to the person who's taking that away to clean it.
Is it recommended or necessary to have a log of all the customers that come in case someone gets sick, or an employee turns out was sick, that you can then get in touch and notify? Are there any recommendations on that?
Take this one, Steve, and please feel free to add to it. But it's definitely encouraged. From our perspective, when we do a follow-up on somebody who's been ill, the more information we have available, the better our fan out and our information to any exposed can be, right? So if I know that Joe came into your winery at 2:00 and that your normal cleaning procedure has you cleaning at 4, then I can kind of go, okay, between 2 and 4, I need to contact the people that might have been in the winery during that time, as well as your winery, your employees. So it's really about trying to have good records, trying to record what you can. There's information on that, again, in the restaurant section. So what I know there's no specific guidance for wineries on WorkSafeBC right now. What I would encourage the wineries to do, and Steve, please disagree with me here if I'm wrong, but I'm going to suggest that if you're looking for some industry-specific guidance, I would really recommend you look at the restaurant guidance. I think that's what you're closest to. So look at the industry-specific guidance for restaurants, because the health authorities a few years ago decided to issue food service permits to wineries. So, we're treating you like a restaurant from our perspective.
Yeah, and I've just sent the Wine Institute's guidelines to Christopher so he can send those out as well. I don't think there's anything in there that you guys haven't already thought about. I think most of them are relating to distancing. There's certainly no specifics in there right now as to licensing issues outside and being able to use different parts of your endorsements one way or the other. But from a protocol standpoint, they have come out with this in the last few hours. But I just wanted just to mention, and I know Steve can back me up on this quite a bit, which is a lot of wineries feel that they're ready to open. They've thought these things through, and they've maybe mapped it out, and they've actually mapped it out, and they've walked through it a bit. But from my perspective, and what I'm telling my clients is, you have to write that plan down, and then bring your tasting room staff in and have them take a look at that plan and kick it around a bit and discuss what things they're worried about on there, what things they think are right or wrong, poke holes in it. And then either on a different day or later that day after lunch, maybe do some role playing with your employees acting as customers. And, you really have to write the plan down according to what WorkSafe's asking for, because if you don't write it down, WorkSafe doesn't feel you've done it. And to be honest with you, your employees want to see it written down as well. It doesn't help if it's in your head and you've just talked about it. You have to write it down, you have to post it, and you have to do those things before you open up. And preferably from a training perspective, you have to do dry runs, I think. It's your responsibility to walk through your, what you're going to be doing with your employees and get their perspective on it. Because at the end of the day, if they don't feel that what you've set up is proper, they don't have to do that work. If they feel that you've set up a work environment that is unsafe for them, they have the right to refuse to do work for you. And so it behooves you to work with them in making sure that the protocols that you're doing are acceptable to everybody. And you thought through some holes. And I know we're getting close to the end, but I just wanted to say in a minute or two, I'm going to post the website. I'm in good contact with Steve and now hopefully with Jen as well. And Steve's been really kind to give me a download of some of the inspections that he's been doing lately, although they haven't been at wineries, they've been elsewhere, but all anonymized, some of the issues that he's seeing when he goes into these locations that keep popping up. And so if any of you guys want to sign up for updates, kind of when we start getting some inspections on wineries, again, anonymized, just to kind of see what out there is issues, then I will put that link on the chat and you can just sign up for reopening updates, I guess is what I'm calling it.
Yeah, and I'm fine with, as long as it's no problem for Sandra, Jen, or Steve. We'll go a little longer because we definitely have some good questions coming up. So one of them is just, of all the mask options, which one does WorkSafeBC recommend?
We're not recommending any specific mask. It's up to the employer to decide what the level of exposure and risk is, and then decide how they're going to manage that risk. So because the mask itself only protects the person who's on the non-wearing side, so we can't prescribe a type of mask. You have to make the decision on what mask is best for your workplace. So if we were to prescribe masks, then we'd have to prescribe the type of training and fit testing that needs to be required for it as well. So the options are on that publication that we've got on selecting the right mask, and then you make that decision. So each mask, the cloth ones, if you choose that, you need to be able to maintain them and clean them. The surgical masks, single use only. Right? So it's a matter of how do you actually need them or not? And if you do, select the ones that will be best for your workplace. So I can't answer that we recommend or require any type.
Regarding staff communication plan, is there a WorkSafeBC example or template you could share or that exists? Well,
in the COVID safety plan, it does talk about that. And then if you go into some of the industry-specific procedures, it does talk about things, how you would be communicating with your staff. The recommendation is to minimize huddles as you normally would have in the morning, and find alternate measures or means to communicate with your staff on a daily basis or when you see fit. So it may have to be via text or chat. But with respect to the procedures, they need to be available for staff to read, either posted in the lunchroom and in the general area for clients to see as well. So we're not prescribing any specific communication method. You just have to make sure that when you're communicating in a way that you're not putting people at risk of exposure by getting into that 2-meter physical distancing area.
There's kind of a couple of connected questions I'll ask now as well. First of all, in terms of posting the safety plan, I think you kind of answered this, but where exactly does it need to be posted, and should it be posted online? Is it recommended to post it online? And obviously physically, where does it need to be posted? And then a second kind of follow-up question as well is, are there any other documents that are mandatory to be posted to our website, such as customer policies or the entire procedure or anything like that? Or maybe not necessary, or at least recommended?
I'll start from our side, if Jen wants to jump in afterwards. But the order issued by the provincial health officer states very clearly that the COVID safety plan must be posted in the workplace, and it must be posted on the company website. The posting in the workplace must be able to be reviewed by staff and possibly by customers, but then you're creating touch points. So that's why they prefer on the website for customers to use. It must be available on the workplace when either a prevention officer from WorkSafeBC or an environmental health officer from public health comes in to ask to see it. So it needs to be available. And there's no other additional things that we say need to be posted other than things that the employer decides to put into place for procedural things for their staff, and also for that delineation of people walking through and whatnot. If you're creating pathways, you have to make sure that it's clear that you're not going to put people at risk by making your pathways or your designated walking areas vague, right? So if you're going to create procedures for people to travel through the workplace, that needs to be posted and made visible so you don't get people bumping into each other.
I wanted to just quickly, I know that we haven't talked about any of these things yet, but there's obviously a lot of issues with respect to working with the public and escalating ire, escalating people who are upset with whatever is going on in their life. I mean, I think you guys know about that better than anyone because you already deal with the public and you get that on a daily basis anyways. But I would hazard to say you'll be seeing more of it during these times just because the general level of stress is higher. One thing I talked about with Steve, and I think it's really important that you internalize this. Don't worry as much about your TripAdvisors and your Google recommends in the next little while. Certainly address them calmly and quickly with the procedures that you have decided to put in place at your own place. So I would put the documents that you would be referring to on TripAdvisor or Google reviews. I would have them there ready to go. Apologize for whatever inconvenience they had and put those documents on because and then you just have to let it go because there will be more of them and you need to be less worried about that. Obviously, if they are specifically asking you questions like, why were you doing this level and the winery next to you was doing this level, I think that's a fair discussion to get into and just act as an interested person that, what were they doing? And I'm going to contact them and we'll have that discussion. So, but just know that, your perfect rating may not be perfect. And then I'm just kind of hoping also that you practice with your staff some ways of de-escalating the situation if things are escalating. And the way that I've always found is the best way to de-escalate a situation, especially somebody who's crowding on the Interact machine and is not, let's say, standing back 6 feet from the person using it, is I just always stop. I have the person stop what they're doing. And then they just reiterate again to the people in line, I can't continue until you're 6 feet apart. And then you just leave the ball in their court at that point. I mean, just those stopping, telling them what the rules are and just politely waiting for them to get back into their little mark on the floor is I think a good way to handle it. You're not in their face about why you have to do this. You're just stopping what you're doing and you won't continue again until they get back into the proper place. So I think if you guys have what I prefer to see through my email, which I put up there, is if you guys, when you start opening, are seeing some real issues and you're also seeing some real wins in how you're dealing with them, please share those with me on my email because then through the Fortify Conference website with updates, I can share those again anonymously with other people on the group. And then, hopefully we'll be learning from what best practices you guys are doing.
A follow-up question around the logs, just if there's a recommended way to get for those visitor logs, if there's a recommended way to gather that information to do so safely.
That's a hard question. I was thinking like a visitor's logbook with a pen, but then you've got shared surfaces. So I don't know, Steve, has that discussion come up at WorkSafe?
Not from my perspective. I know the log, they're looking at it from the public health perspective on the coast for contact tracing, right? So, you have one person in a group, they would usually provide their name and contact. From the worker perspective, is just knowing who's on site. So we don't really have much in the way of influence on records of clients, and some people might not want to give their name and phone number.
Well, I know that a lot of wineries are moving to reservation systems of one format or another. That's one way to collect their emails. The other way I thought that was pretty interesting is without having to share the pen is you could ask everybody in a group to write down their email address, and then you just use your phone to take a picture of it after they've exited, after they've left, and then discard it.
If you have a party, right? Like, let's say you have a wedding, like a bridesmaid's party, you just need one contact, because that person will be able to tell you everybody who was in that party.
I can guarantee you that most wineries are not going to be allowing in those types of groups for the next little while.
Something I did want to just really quickly mention, Sandra, is that public health and throughout the province, we're working on guidance documents to supplement kind of that public-facing side, right? So the tracing, going back to some of those normal procedures that you follow and risks that might be associated with what we're asking you to do. And then looking at it again from that public-facing side. So remembering that WorkSafeBC is really focused on employee safety and the worker safety, whereas we're looking at the public safety. So there will be guidance documents. They're going to be very similar and have a lot of the same components as what WorkSafeBC has come up with. But there might be some slight variations for dealing with the public. And my hope is that those will be out next week. And if once those are out, I can commit to sending Sandra a link to those. I don't know if they'll be on our website, like the IH website. I suspect that they're going to be provincial. And so they will be on either BC CDC or the provincial restart plan site. So again, I'll find out about those probably about the same time that the news papers and
that would be great if you can pass them on, and then I'll pass them on to the people that sign up. And then, because it was my understanding that the WorkSafe COVID documents or site, part of their website, Steve, already had quite a bit of input from the health authorities as well, integrated into it. So I guess, Jen, what you're talking about is probably just really, really specific things just for the public side, right?
Just a few additions that, and again, a lot of it will be repetitive. A lot of it will be the same information, maybe from a slightly different lens. But and that's, I guess, why we haven't been panicked to get it out, is because we do feel like what WorkSafe has put in place is going to address the vast majority of the concerns and gives people enough to kind of digest for the moment.
A couple of comments people made was, one, just have your staff for the visitor log, just have your staff write it down. So if you need that one name, just have a staff member, or else just get those little golf pencils that are easily disposable. So just a couple options. I think maybe the final question I have here is just around using plexiglass screens, if they're strongly recommended, if most tasting rooms are going to be using them. Yeah, so on plexiglass.
So that's one of the engineering controls. Again, we have created a document on designing effective barriers. So really it is just something to minimize that exposure. And I know it kind of flies in the face of the guest experience at a winery. However, they're showing up in nurseries. They're showing up in all sorts of other places as well. So we have some general information on here that speaks to the person's breathing zone. So we don't expect the worker to be encapsulated by polycarbonate glass, but just thinking of if you can't maintain that 2 meters distance, how can we effectively place something that could minimize the potential exposure in the event of a wet talker, a sneezer, a cougher, or sometimes it's good to have that physical barrier from people that just are touchy-feely and wanting to hold your hand or shake your hand or something like that. Those inadvertent human interactions are sometimes hard to step back from, right? I get that a lot where I walk into a place and immediately somebody puts their hand up to shake their hand, and 9 times out of 10, you feel your hand going towards it. So the plexiglass can not only prevent that exposure, it can also minimize that inadvertent contact as well. But again, read the document, and it's got some good information on it.
And just one last thing, Christopher, when I was actually going around to wineries last month and buying some wine through their drive-thrus, I found, I went to 3, and my fault for sure, but at all 3, the one place that I was not able to stay with the 6 feet different distance was when the case of wine was loaded into my trunk. That was the high risk area for me. I wasn't doing any tastings even. So at the point where they were coming out to put the case into my trunk, that's where I came right up to the trunk to close it. And so again, think about things like putting the case of wine on a table, possibly that's in front of where the cars will pull up to, and then just walk away from the table and let them put the wine in their own trunk. So I'm going to be putting things like that out because I think really the intent I had at each one of these places was to stay 6 feet away, and I did great right till the very end, and then I was right next to them when I was closing the trunk. And of course, they weren't pulling back either. So when we're talking about things like risk assessing your place, you have to do it right from when they're making the phone reservations right through to when they're exiting your driveway. It has to be complete.
Well, I think that's everything. Thank you so much, Sandra, Jen, and Steve. As always, we'll send out with a YouTube replay, we'll send out links and all the documents and everything. So, Jen and Steve, if you have any further docs you'd like to share, links, articles, resources, we'll make sure to get that to not only everyone who's participated today, but people who've participated in the past. A reminder, next week, we've got Dr. Julie Rosenberg on, who's going to be talking about leading through adversity and crisis and doing so successfully, kind of managing through this pandemic. I think that's going to be really enjoyable. And just lastly, I threw up, just because of the contact or the discussions we've had out here, I threw up a blog with some thoughts just on new wine discovery, how to help people find your wine. Because of the feedback we've heard from guys like Jerry and Leanne, it was awesome. So you can find that at vitality.ca. That's our website. And with that, thank you so much, everyone, for coming. This is great. Thank you especially to Sandra, Jen, and Steve for taking the time. Have a great day, everyone.